Good evening, class and professor, and thank you for watching my video reflection regarding mental health and substance abuse disorders. These topics are vital to address as these disorders are prevalent here in the United States, yet remain highly stigmatized health conditions. As future nurse practitioners, we will all have patients with one or both of these disorders and must be comfortable caring for this population. After reading this week's materials, one thing that surprised me was the lack of understanding regarding the causes of mental health. While there are theories regarding the etiology, such as genetics or brain damage perinatally, there is still so much unknown regarding the exact causes of these disorders. What did not surprise me, however, was the prevalence of mental health issues. Many are able to function, but still struggle and go undiagnosed, such as the case in some depression, mood disorders, and panic attacks. For example, 20% of women and 12% of men struggle with depression, and this is the most common reason for seeking mental help. Signs and symptoms can range from mild to life-altering. Unfortunately, many milder forms may be misdiagnosed and not receive proper treatment. Other mental health disorders, such as schizophrenia, classified as psychotic illnesses, may be more obvious, but are less common. Nonetheless, long-term treatment, which is often a combination of different therapies, are necessary to help treat the disorders. One thing I learned about mental health disorders that really stuck out to me was the fact that bipolar actually falls under the depression category. Having a family member recently diagnosed, this is important information to understand. I was always under the impression that bipolar was actually a diagnosis all in itself. After reading this week's chapter, I realized that depression is actually categorized into subgroups, including major depression, which is also referred to unipolar, bipolar depression, which alternates between depression and mania, and exogenous depression, which is reactive to a life event. In addition, postpartum depression and atypical depression are other types that fall under the major depression category. Second, I learned that many of the medications used to treat depression focus on neurotransmitters. The main ones include serotonin, norepinephrine, and dopamine. The third piece of useful information I learned is that the Diagnostic of Statistic Manual of Mental Disorders, or DSM, is the manual used to classify mental illnesses. Lastly, I gained a better understanding of schizophrenia, which is important to learn as future primary care providers. Schizophrenia is not how it is portrayed in the movies. In fact, typically there are three phases, including A, prodromal, B, active, and C, the residual phase. Prodromal is the earliest stage. Active stage is when symptoms are most severe. And the residual phase is when cognitive symptoms are evident, and they can go through the cycle. Symptoms are broken down into positive symptoms, in which the psychotic symptoms arise. These include hallucinations, both auditory and visual, and disorganized speech and behavior. Negative symptoms are when there's a removal of processes, and this is when patients often present with a flat affect. Third is the cognitive symptoms, in which they have difficulty learning and understanding and may present with poor memory. Substance abuse and mental health can often go hand in hand. It is necessary to monitor and treat both. Substance abuse includes alcohol and both prescribed and illicit drugs. One thing I found interesting was that the World Health Organization estimates that for every dollar spent in substance abuse treatment, there is a $7 savings in related healthcare. This is a huge amount of savings and highlights the importance of early recognition and treatment. Second, I learned that alcohol contains ethanol, which decreases various inhibitory and excitatory neurotransmitter pathways. This is what leads to the feelings of euphoria, relaxation and less self-conscious feelings, as well as loss of balance and coordination. Lastly, I learned that a blood alcohol level of 0 to 0.05 often results in that happy, relaxed feeling, with only a slight loss of coordination. A level of 0.06 to 0.15 leads to increased loss of impairment, including speech, memory, and coordination. This is also when aggression may present and driving is impaired. Alcohol poisoning, blackouts, and vomiting occur when levels reach 0.16, and death can occur when levels reach greater than 0.31. Much of the information learned will be helpful in my future practice as a PNP. Mental health is a disorder that affects people of all ages. Children and adolescents are no exception. It is vital to assess for and address any mental health concerns as early as possible to mitigate future sequelae. Using the DSM will be useful in diagnosing mental health disorders in the pediatric population, as the criteria are different in adults than children. For example, diagnoses of generalized anxiety disorder, according to the DSM, requires only one symptom to be present, while adults require 3 or more symptoms to be diagnosed. Addressing substance abuse is just as vital, as the use of these harmful substances can have detrimental effects on their health, including death, if not addressed promptly. Unfortunately, substance abuse is becoming more prevalent in the adolescent population. Therefore, understanding how to recognize the general indicators of substance abuse is necessary. Educating the parents that a change in friends, academic achievement, interest in sports, or increase in risk-taking behaviors are red flags for substance abuse in the adolescent population. By educating the parents and children early on regarding both mental health and substance abuse disorders, we can help to mitigate the stigma that comes along with it. Thank you for listening to my video, and I hope that you learned, and I'm looking forward to learning from each and every one of you.